Hello, my fellow VSG'ers. This is Joe Saint and my sidekick, Frankensleeve, coming to you with another quick fact: frequently asked questions. And this frequently asked question is, what should I pack with me to the hospital? And I can tell you that what I packed was almost nothing. I brought my robe, and I brought my cell phone, and I brought my friend, who was my driver. He brought along his camera because I wanted to film myself coming out of surgery, so he was kind enough to bring his camera and did film me as I was being wheeled back into the hospital room after the surgery. I was quite groggy, and it wasn't very flattering, but I did want to record the event. Other than that, I didn't need anything. I had a TV set in the room and remote control and my ice chips, and I was in quite a bit of pain, so I didn't want to do anything else. I've seen other people who, bring their laptops or they bring their smartphones and start blogging or surfing the web. I wasn't feeling up to any of that after my surgery. But if you want to find out what you will need for surgery or suggested tips, if you'll go to Google, and in quotes, it has to be in quotes to find this easily, is you put quote mark, what you will need for your gastric sleeve surgery, end quote, in the Google search bar, and search, and the first results that came up in my search results was the site Vertical Sleeve Talk, and that's the name of the thread, what you will need for your gastric sleeve surgery. And there is a document attached to that thread that you can download and open up, and it will show you a ton of things that people have thought to bring with them that made their stay easier. For example, the clothing. They say bring comfy pajamas. I plan on just wearing the hospital gown, which was more than enough cover for me, but some other people may feel a little bit more exposed. But my gown at the hospital was not like the kind of gowns you see on the TV where your butt's hanging out and you're got these little laces at the back. Mine tied in the front and actually wrapped around me so that I was completely covered at all times, whether I was walking, standing, sitting up, or just anywhere. So I was not exposed at all, and I felt very comfortable walking around the floor wearing that gown. The hospital also provided me with some non-slip socks from the very first moment I got there. So when I undressed and got ready for the surgery, I had these screaming yellow socks with little rubber soles on them that would grip the floor and keep you from slipping, and the gown. And I was more than comfortable wearing all that stuff. The other thing they say to bring, which I did bring, was my robe, but I never actually wore it. Loose underwear, warm socks, house slippers, loose fitting clothes to wear on the way home, and that is a good idea. I wore loose fitting clothes on the way up there, so I wore the same clothes home. They say you can bring extra lotion, deodorant, toothbrush and paste, shampoo and conditioner, a blow dryer, snacks and water. I wouldn't bring any snacks because you're not going to be allowed to eat anything before surgery or after surgery. Until you do your leak test, the only thing they'll let you have, at least in my case, the only thing they let me have was just ice chips. They didn't want me drinking any liquids that could pool in my stomach and possibly leak out of my stomach and into the body cavity and cause an infection. If you do have a leak in your stomach staples or your stomach stitches, and water gets into your body cavity, you can pretty much count on being in the hospital for an additional 3 weeks. That's one of the things that they pointed out to me, was you will immediately get peritonitis and you will not be going home, because even though the water is safe to drink, it does contain bacteria which will invade your body if it gets a chance. So don't drink any liquids after surgery. Just chew on your ice chips. For some reason, ice chips are just fine. They don't, I guess because you eat them so slowly that they don't have a chance to really pool in your stomach. But they were perfectly fine with me eating ice chips or popsicles. Just no sips of water. I did make the mistake of sipping too much water after they did the leak test, and then I was surprised at how little water it took before I was throwing up. It didn't take much. I mean, just a mouthful, and I was done. Some people suggest bringing gas X strips for the gas pains. I didn't bring any. I had gas discomfort, but nothing really tremendous. When I first got out of surgery, I can tell you that I knew exactly how that guy felt in the original Aliens movie when he was laying on the table and the thing popped out of his chest. I felt just like that. I'm with you, brother. I know how you're feeling. But they hooked me up to the morphine drip, and in about 15 minutes, I was feeling no pain. They would come in every few hours and say, "What's your pain level from 1 to 10?" I was like, "It's a 1. 1. And I'd be hitting that button on the morphine drip like I was playing a video game. They also say bring throat lozenges. I would, in the list also says check with your surgeon just to be sure, because like I said, they told me not to eat anything or drink anything past midnight the day of surgery. So I didn't drink or eat anything after midnight the day of surgery, and I didn't drink anything other than ice chips after surgery, and I didn't drink any liquids until after the leak test the day after surgery. Let's see, what else have they got on here? Breast strips, body wipes, tweezers. Well, body wipes they gave me at the hospital, so that wasn't a big deal. Tweezers, I had no need for tweezers. A heating pad for pain relief. I was so wrapped up that I didn't need any kind of heating pad. They had me in that upper body elastic bandage that they put around you to support your stomach and support your stitches so they don't stretch. So I didn't need a heating pad. Actually, I'm so hot-natured at the time that I was just, all I had on was just the sheet on top of my robe, or on top of the hospital gown. Bring a friend. That does help out a lot. Small, firm pillow. Some people say bring a pillow with you for when you sit up in bed, to put the pillow on your stomach and hug it like you're hugging a teddy bear, so that it puts pressure on your stitches and they don't move as much, and your stomach internally doesn't move as much. It does. They say it does help reduce the pulling sensation when you stand up and sit down. Like I said, I did not use that small pillow. I never really felt that. The medication was keeping the pain at bay enough that I could get in and out of the hospital bed with no assistance and no discomfort. Cell phone, I brought my cell phone, but I never used it one time while I was there. Bring the charger or any kind of cord you need. Bring reading materials. Bring reading glasses. Stuffed animals for, I guess, emotional support. Craft items. If you're going abroad to Mexico for your surgery, bring a Spanish-English dictionary. Bring you an eye mask and earplugs for sleeping. That's something I've forgotten completely about. Those hospitals are loud. It's like they were having construction going on all the time. It wasn't real construction, but the noise of them rolling the carts up and down the hallways, the noise of people talking in the hallways, it just echoed up and down the hallways. It was loud. And it was definitely not a place for resting if you were trying to rest, because it was difficult to sleep, even with the heavy wooden door closed. So, the other thing they say, possibly bring a pen and a pad of paper. I guess if you can't talk, you can write down messages to your friends, tell them what you want. But that is the biggest. That's the biggest items that I see on this list for what you should bring with you to the hospital, or you might want to bring with you to the hospital. So that's it for the list of items that you might possibly want to bring with you to the hospital. Like I said, I didn't bring much of anything with me, just my phone, my clothes, and my friend with the camera. You might want to give your wallet and stuff to your friend to secure for you while you're in the hospital. The only thing I really needed was an ID when I checked in. Oh, one more important thing, memorize your first, last name, and date of birth. I swear, it seems like every person that walked into my room, from the nurse drawing my blood, to the nurse taking my blood pressure, to the anesthesiologist, every time somebody would walk in my room to do some type of treatment on me, the first thing they asked me was, name and date of birth. It got to the point after about the 10th time when I saw someone walking in the door, I would just say my name and I'd immediately spiel off my date of birth. And they started laughing at me because they didn't know why I was doing this, but they do this every day, so they should have known why I was doing it, because they ask everybody their name and date of birth so they can confirm that they're doing treatments on the right person. So this is Jote Saint and Frankensleeve saying goodbye from VSG land, and keep pimping that sleeve.